Oh, well, hello. I didn't see you come in. I was just reading a good book and drinking some chamomile tea. That is good stuff. Well, while I have you here, I'd like to take the moment to say the video you're about to watch was filmed for educational purposes only. The actors and actresses in the video do not support nor in any way do they participate in the content that you are going to be viewing. No animals were harmed in the filming of this movie, nor alcohol consumed, and certainly no STDs transmitted. Well, with that being said, enjoy your film. Oh yeah, it's Friday. Yo, E-Man! What's good, Frankie? Let's take some shots. Let's pour it up. Pour it up.
Now he has such everlasting, not flashing, not at all. But see, my nigga want to do a little acting. That's for anyone asking, anyone asking. Drip, drip, drop, there goes an orgasm. Now you coming out the side of your face, you tap it right into your.
According to the CDC, in 2015, a total of 395,000 cases of gonorrhea were reported in the United States. Since 2014, the rate of reported gonorrhea cases has increased 12.8%, and since 2011, it has increased 19.9%. Many women with gonorrhea are asymptomatic, and the viewer should be very concerned about this fact. Little does Ethan know he's flirting with danger, for this girl has gonorrhea. Gonorrhea is transmitted through sexual contact with penis, vagina, mouth, or anus of an infected partner. Ejaculation does not have to occur for gonorrhea to be transmitted or acquired. Gonorrhea can also spread perinatally from mother to baby during childbirth. People who have had gonorrhea and received treatment may be reinfected if they have sexual contact with the person infected with gonorrhea.
What the?
Incubation period for gonorrhea is 2 to 5 days. Symptoms for men and women can sometimes be asymptomatic. In men, when present, signs and symptoms of urethral infection include dysuria of a yellow, white, or green urethral discharge that usually appears 1 to 14 days after infection. In some cases, men with gonorrhea may also complain of testicular or scrotal pain. When a woman has symptoms, they are often so mild and nonspecific that they are mistaken for a bladder or vaginal infection. The initial symptoms and signs in women include dysuria, increased vaginal discharge, or vaginal bleeding. Between periods, women with gonorrhea are at risk for developing serious complications from the infection, regardless of the presence or severity of symptoms. Symptoms of rectal infection in both men and women include discharge and itching, soreness, bleeding, or painful bowel movements. Rectal infection may also be asymptomatic. Pharyngeal infection may cause a sore throat but also be asymptomatic.
Doctor?
I'm your Dr. Ramirez. Nice to meet you. So I wanted to talk to you today. We went over the tests, and I don't know how to tell you this, but you have gonorrhea.
What?
So, gonorrhea is diagnosed by testing the urine, urethral for men, or endocervical or vaginal for women. Specimens include nucleic acid amplification testing, or NAAT. It can also be diagnosed through gonorrhea culture, which requires endocervical or urethral swab specimens. If a person has had oral or anal sex, pharyngeal and a rectal swab specimens should be collected either for culture or for NAAT, if the local laboratory has validated the use of NAAT for extragenital specimens. The treatment for gonorrhea, it can be cured with the correct treatment. CDC now recommends dual therapy for the treatment of gonorrhea. It is important to take all the medication prescribed to cure gonorrhea. Medication for gonorrhea should not be shared with anyone. Although medication will stop the infection, it will not repair any permanent damage done by the disease in Ethan's case. Antimicrobial resistance in gonorrhea is of increasing concern, and successful treatment of gonorrhea is more difficult nowadays. If a person's symptoms continue for more than a few days after receiving treatment, he or she should return to the health center to get reevaluated by the care provider. For methods of control, don't have sex. But realistically, use condoms, get screening, get your partner tested for STDs as well. And that's all. Okay, Ethan, now that you understand you have gonorrhea, I have some medication for you that you're supposed to be taking for the next 10 to 14 days. Do not skip the treatment because we have to get rid of it for you. Also, I want you to know that safe sex is best sex. So here's a condom for you to use at all times from now on so you don't ever get it again.
Oh boy, thanks, Doc. Let's party! Got keys, got wallet, got condoms.
One pull up in. One down. Yo! Eee! I don't know. You want to take a shot? Is that what I'm doing?
Okay. It's not recording, right? There you go.
Don't stop, nobody won't quit. So full pipe down, you ain't talking about shit. My chick bang, tell me if you seen her. She always bring the wacky like Venus and Serena. All white top, all white belt, and all white jeans, body looking like milk. No time for games, she's full grown. My chick bad, so sick to go home. My chick bang,
I think.
Action.
Doctor?
What were you thinking?
Action.
Now that you understand what you have, Ethan.
Action.
Now that you know.
Ready?
Maybe not.
Okay, ready?
Yeah.
Yeah.
1, 2, 3, action.
Okay, deep breath. You got this.
Ready? Action. Action.
Oh yes, another Friday. Everyone say, hey, we want some shots. Hey, we want some shots. Let's go, boys. Let's pour it up. Let's pour it up. Pour it up for you and one for me. Woo! Cheers. Woo! Woo! Okay.
Really bad. By the way, you have cancer.